We are here today to talk about treatment for one type of breast cancer. I'm here with Dr. Sonia Hepburn, an oncologist with Virginia Oncology Associates. Dr. Hepburn, thank you so much for joining us today.
Thank you for having me.
Well, we're talking about HER2 breast cancer. So first, what is HER2 breast cancer and how common is it?
Sure. So HER2 breast cancer is a type of breast cancer that expresses that HER2 protein on the breast cancer cells. It's one out of the three different types of breast cancers you can have, and it tends to be about 20% of all the breast cancer diagnoses.
Okay. What is the typical treatment for HER2 breast cancer?
So it used to be that back in the day, they used to start with surgery first, followed by chemotherapy. Now we know that it's much better to actually do the opposite, to start with chemotherapy and then add HER2-directed treatments in addition to that in a what they call neoadjuvant approach. So that just means that they're starting treatment before doing surgery. And we know that that's important for two different reasons. The first reason being that it helps shrink the tumors to improve surgical outcomes, but then it also gives us a window into how responsive the tumor is going to be to our treatments.
I know that there have been some advances over the last couple of years in treatment for HER2 breast cancer. Can you talk about some of those advances?
Sure. There are certain treatments that have come out recently, like in the 1990s, they came out with new treatments called trastuzumab and pertuzumab. Those are fairly commonly used for HER2-directed treatments. There are currently clinical studies underway to help with the HER2-positive breast cancer patients that have disease that spreads to the brain, which is fairly common. But more and more, they're trying to figure out which patients benefit from more treatment versus those that benefit from less treatment so that we can improve overall outcomes and have less side effects.
Anything you have to say to help them, to help ease their mind if they are dealing with this situation?
Sure, I want them to know that there is hope. There are many treatments that are coming underway that are looking to improve patient outcomes overall, and that we're here to help. I know that this is a difficult situation, but ideally with their help of their family and friends and with us involved, will help make for better outcomes.
Where can people go if they have more questions about HER2 breast cancer?
Sure, they can call our office at any time, or they can go onto the website at virginiacancer.com.
Dr. Hepburn, thank you so much.
Thank you.